It's early morning at UCT Private Academic Hospital in Cape Town, and 37-year-old Margot Joseph is being prepped for her upcoming uterine fibroid embolisation procedure. This is a cutting-edge surgery which is increasingly being used around the world to treat women with uterine fibroids. Radiologist Dr. Gary Sudwarts specialises in this treatment. He offers the procedure at UCT Private Academic Hospital in Cape Town, as well as Netcare Park Lane and Netcare Linksfield Hospitals in Johannesburg. Dr. Sudwarts arrives to put Margot at ease.
2 weeks will be back at work without any problem. There's a much shorter recovery than you'd expect after a myomectomy or a hysterectomy, which is about a 5-6 week recovery. I will give you antibiotics in the procedure.
Margot is a pediatric nurse and has been part of medical procedures many times before, just not as the patient.
Well, when you're at the other side, it's not easy. When you're the receiving side, yes.
Yeah. Right, so the procedure itself is about an hour. You'll be back in the ward about an hour and a half. So I think we're all ready to take you through to this. I'm going to get changed into my scrubs, and the next time you see me, I'll be all in green. Okay?
Thank you, Doctor.
In theatre, Dr. Sudwarts' team gets ready.
So fibroid is a benign growth of the muscle of the uterus. So it's the muscle and the fibrous soft tissue of the uterus that overgrows. It's a benign tumor. It's not cancer, it doesn't become cancer, and very, very common.
Fibroids are very common, occurring in some 20 to 40% of women. And of those, about 40% require treatment. In Margot's case, one of her fibroids had grown to 9 centimeters in diameter, the size of a large grapefruit or small melon, and was causing her extreme discomfort and severe bleeding. She fears she'll never be able to have children because of the fibroids.
So they can get very, very big, sort of, more than 10 centimeters in size, and when they grow, the uterus gets bigger and bigger, and then the fibroid interacts with the function of the uterus, so it can cause bleeding and pain, and then it can cause infertility, bulk-related symptoms, constipation, and urinary symptoms.
Fibroids contain a large number of blood vessels and draw a great deal of blood into them and therefore into the uterus. Added to this, they also stop the uterus from clamping down to stop the bleeding that occurs as part of a normal menstrual cycle. That's why women with fibroids can bleed continuously, so much so that it can become life-threatening. Some women with this condition can get by with pain medication and iron supplements, but many require further treatment. Traditionally, large fibroids were cut out of the uterine wall, a procedure known as a myomectomy. This was done either through open surgery or in recent years by laparoscopic or keyhole surgery.
Options were very limited for women who had massive fibroids before until this procedure really developed and gained the traction and the science behind it. So those women unfortunately were offered hysterectomy. Some of them didn't even have families at that stage and lost their uteruses. Unfortunately, far too many women still have hysterectomies because they don't know that there is another option available to them. So where fibroid embolisation actually fits in is that it's become an alternative. Obviously, in the right patient, this procedure is absolutely equivalent in benefit, and yet far, far less invasive than a hysterectomy.
The procedure is done in a special catheterization laboratory. Large video screens allow the surgeon and his team to map the arteries through X-ray systems. Catheters and wires are inserted through a tiny incision in the patient's leg and navigated to her uterine artery.
I've got a syringe full of little particles that I've connected up to a small tube that's coming out of the leg. But the tip of that long catheter is actually in the uterine artery. We inject this very dense concentration of thousands and thousands of microbeads. And this massive number of tiny little microscopic beads goes into the small capillaries that supply the fibroids, and they are in that way their blood supply is diminished.
The plastic beads are just the right size to block the arteries to all fibroids anywhere in the uterus, cutting off their nutrient supply, which then kills them.
Second is fine.
Within minutes, the images of the convoluted multiple fibroid arteries on screen begin to disappear. It's known as a pruned tree. The results are almost instantaneous.
Yeah, I'm very happy. Okay, so we're just going to do a little run over here. Should show. So the uterine artery is still supplying, but there's much reduced flow inside of it. We are finished. You're drifting.
I'm drifting, yes.
How are you feeling?
Okay, so what we're looking at here, this dark shadow, this is your bladder outline. The white is the balloon that is blown up inside to hold the catheter in place so it doesn't fall out. And then round here, this other shadow that you see, the darker shadow coming up here, is the fibroid itself. So this whole area is the fibroid.
You did great, Margot. All done, hey? Hope you had a good rest.
Thank you so much.
Only a pleasure.
It's 2 days later, and we catch up with Margot before she leaves the hospital to see how she's doing.
I'm doing very well for the second day post-op. And in 2 weeks' time, I can go back to work. So it makes my life so much easier. So for me, this was the best option. This is such a huge thing for me. And I'm so happy because when I found out I had fibroids, I thought that there was no chance that there was no, to have future pregnancies. So the doctor gave me really hope, and doing this procedure gave me that option. That is it was such a relief for me.